we're going to move over to our clinical conversations. Clinical conversations are exactly what it sounds like. They're conversations that either Jason, myself, or both of us together have with other healthcare providers to talk about how they think about approaching patient care, how they think about treatment, and how they think about their business of practice. All of those topics and more, depending upon who we're talking to. And today we are going to play a video from a conversation we had with Dr. Brandon Money. He's out in Broomfield, Colorado, in a practice that focuses on regenerative orthopedics. He also is certified from Titleist Performance Institute, which I know will be super familiar to a lot of chiropractors out there. We were fortunate to sit down and have a conversation with Dr. Money about posture, about golf, about how he approaches practice. We're going to play a clip of that conversation now, and you can check out the full-length interview on our YouTube channel. So without further ado, hey, Smart Chiropractors, Dr. Jeff Langmaid, part of your Smart Chiropractor team here, and I am fortunate to be sitting down again with Dr. Brandon Money at Centeno Schultz Clinic. We're going to discuss posture, which is our Smart Chiropractor campaign, and really break down clinical aspects of it, how Dr. Money thinks of it, how we can think about it, and really just talk down the overarching theme of posture. If you have any questions, drop them down below. Brandon, thanks for taking some time and coming on today.
Absolutely. Thanks, Jeff. I appreciate it.
You got it. So when I think of posture, I know a lot of people, the public, think of chiropractors as like these postural experts, but there's a lot more to it than that. And I know in your practice, I'm assuming it can be a big deal. And I just would love to start with the concept of how does posture play a role in your practice when you're evaluating a patient, let's say with a spine issue?
Absolutely. And, we think about the spine, it extends from, the base of our skull all the way down to our tailbone and everywhere in between. So our posture is something that we don't think about, unfortunately, enough, I feel, because we sit in a chair, whether we're at a desk job or whether we're sitting on the couch watching TV, and we try to get ourselves in what we think is the most comfortable position, not necessarily what is the proper positioning. Right. And the way we think about it is that, we have our spine, so that's the structural component, but we have ligaments, muscles, and tendons that all help support the spine from top to bottom. And we're all imbalanced in one way or another. And what I tell patients is, we have balance both left and right, and one of us, and we're all either left dominant or right dominant. So we're already biased to one side versus the other, but there's also front to back symmetry as well. And, when we think about core strength, the idea behind the core is that, we want that six pack and the abs, but the core is such a more complex structure. And we think about the anterior muscles, and we often forget about those posterior muscles, which really help keep the spine in alignment. So that often comes into play when we're going through our thought process of what we think can help the patient as far as, getting them into better alignment to help improve their posture. And it may be something that's a long process because they've been sitting poorly. And I can see myself right now. I'm leaning forward in the chair. My elbows are sitting on the desk. My head's protruded forward. So now that we're talking about posture, I'm thinking about it myself, and I need to get back into how the chair was designed for me to sit. And over the course of 8 hours a day, 5 years, 10 years, 20 years, whatever it is, we really get those muscle imbalances where our anterior muscles get tight, our posterior muscles get weak, and that throws everything off.
No doubt about it. And I know when you guys go through your examination and evaluation process, that's almost part of it with the SANS or SANS approach. I'd love for you to talk that down and break it down, because as chiropractors, or I'll speak for myself, I always think about things segmentally, regionally, and then whole body. And I kind of break down movement patterns in that context. But during your evaluation process, how are you thinking about posture? Is it whole body? Is it regionally? Is it segmentally? Is it a little bit of all? I'd love to know your thoughts as you go through your evaluations with your patients.
Yeah, absolutely. And I think we do think about it segmentally, regionally, and then more globally in the spine itself, because we may not see global changes, but the issue itself can be global. When I think about, say, a knee, for example, in a patient, well, they have knee pain. They don't necessarily have back pain, but during our evaluation, we may find evidence of some low-level radiculopathy. They lose a little bit of sensation, or they get hypersensitive, and they're L5S1 dermatome. And then we say, hey, let's get an X-ray of your low back. Shockingly enough, there's a little bit of a spondylolisthesis going on at L5S1, which is ultimately causing or helping contribute to their knee issue. So, and same thing, say a shoulder, elbow, hand, whatever, looking at the cervical spine, because what I tell every patient, just like the song we learned when we were 5, the ankle bone's connected to the knee bone, connected, and you know how it goes after that. Because it is true, because if there's one area that is thrown off, it can either downstream or upstream affect those adjoining areas.
All right. And that was Dr. Brandon Money from Centeno Schultz Clinic out in Broomfield, Colorado. If you'd like to see the conclusion of that conversation, I'm going to encourage you to head over to our YouTube channel where we are posting all of our clinical conversations. Hey, if you like that video, be sure to subscribe to The Smart Chiropractor. We are posting videos on how you can market your chiropractic practice in a way that teach and invites consistently. We have found that is the magic formula to big time growth. So if you like this video, be sure to comment down below, smash that subscribe button, or visit us at thesmartchiropractor.com.